And the question that I have is, do you think, unionization, how do you think that would impact healthcare? Do you think that would, my immediate thought is something like that would drive costs up, up. Welcome back to the Pharmacy Rockstar podcast. Get ready for another jam-packed episode filled with invaluable insights, entertainment, and motivation. I'm your host, Dr. Steve Rodriguez, a pharmacist, certified mergers and acquisitions advisor, and rock and roll extraordinaire. A huge thank you to each and every one of you for joining us today. Don't forget to leave a comment, rock the like button, and subscribe to our channel for more exciting content. Today, I have a very special guest. He is a former senior management executive, having worked with United Health Group, Cigna Healthcare, and Blue Cross Blue Shield. He is an innovator with experience growing and improving health plans and healthcare service organizations. He has served on multiple nonprofit boards, including the Rock and Roll Hall of Fame. Let's go. He's on a mission to improve access to healthcare for patients in rural areas and provide value for independent pharmacies. He currently serves as a CEO for the telemedicine innovators at MyPhysician360. Ladies and gentlemen and fellow rockers, welcome to the Pharmacy Rockstar podcast, Mr. Michael Muchnicki. All right, Michael. Hey, thanks again. Thank you once more for joining me on the Pharmacy Rockstar podcast. Hey, so let's just get right into it. I know my audience is going to want to know, what was your role at United Health? Tell me about that.
I started at age 27. I was a CEO for United Healthcare in Ohio, moved, transferred down to New Orleans, spent several years in the Gulf States down there, and then as the CEO for the South Florida and the Caribbean for United Health Group. And said close to over 10 years of operating health plans in all those different markets for United Healthcare.
Okay. Wow. And you did that for how long?
A little over 10 years.
Okay. All right. Well, so my understanding is you are already gone at this time, but United Healthcare ended up acquiring OptumRX, correct?
Yes, Optum is an offshoot of a bunch of different companies that they put together that focus in on technology services, pharmacy services, healthcare delivery services now too. It's really a services arm of United Health Group that they actually go and they sell to other health plans as well, not just servicing their own clients, but it's an entity that was kind of created for ancillary services and really to build up another great big business.
Yeah. So what are your thoughts on that? In my space, as a pharmacist, as a former pharmacy owner, there's PBMs are looked at as the greedy middleman, right? And so a lot of, independent pharmacies, they're reimbursed below cost whenever they fill a prescription. You have, United Health owns Optum, and they try to steer patients, to that mail order pharmacy that they have. A lot of people would say that that's somewhat of a conflict of interest and monopolization, in the pharmacy space. What do you think about that? What are your thoughts on that?
It is. Again, this is just when you're operating a big company like that, it's really just trying to drive down the lowest cost you possibly can. And a lot of times it does affect quality when you do that. And that's probably one of the biggest challenges we have as an industry is to how do we continue to provide a reasonable premium for employers, for patients, and people that are on Medicare, Medicaid, but provide them benefits that are useful. And so they continue to look at different ways to kind of slice that premium dollar and drive down the costs. And unfortunately, I've heard it too, just like you have on the pharmacy side, that pharmacists really have taken the brunt over that over the last several years. And which really leads to why we've got to look at trying to reinvent the pharmacy, the rural pharmacy, the retail pharmacy, separate from the big Walgreens and CVS's, because there are many individual entrepreneurs like yourself probably that are have great opportunities to really look at some transformation opportunities for pharmacists.
Right. No, absolutely. So being that these insurance companies, these PBMs are publicly traded companies, I've always believed, whenever I had my store, these companies, there's nothing, their job is to take care of their stockholders. That's where their loyalties lie, and they should be. It is what it is, And so So with that being said, their loyalties lie with their stockholders, not with the taxpayers, not with plan sponsors. So, so how can they effectively improve access to healthcare and lower healthcare costs? How can they physically do it?
It's hard because they always have to drive a profit, as you said, and so there's always that component, and then you have other entities such as Blues plans that don't operate on the same level of having to have shareholders, but at the same time their premiums are the same as United's, so it is a challenging environment, and you look at providers too, the physicians, pharmacists, others, they're the ones that really take the brunt of the cost reductions every time. And when there's a lot of duplication, there's a lot of administrative costs. I think also too, from a regulatory standpoint, we're highly regulated too, and that also I feel like drives up the cost of what the insurance companies have to do to put a premium out there. So, being on the insurance side, we have a lot of challenges, but there is a lot of duplication and a lot of unnecessary things that do go on. And if we were able to put things back into the hands of the provider, we've seen a lot of that with value-based care coming around, rewarding the providers to do the right thing for the patients, and that really does help a lot. And we were seeing a big growth in value-based care that puts really the care back into the arms of the patient and the doctor. And I think that's the future of what we've got to do, is really focus in on how do we get out of the way as an insurance entity and let the doctor and the patient really manage their care. That's my philosophy too. And since I've left United.
Yeah. No, that's great, because, that was kind of, kind of lead into my next question is, physicians, pharmacists, everybody who gets paid by these third-party payers, they get very frustrated. It's very frustrating to see when, whenever I had my pharmacy, there was times where I couldn't fill someone's insulin for example, it was no longer covered on the formulary. And I'm like, look, if this person doesn't get their insulin, they're going to end up in the ER. Yep. They're going to have to go to the ER, to get their blood sugar under control.
And that drives up costs, and that drives up more cost. And I think we saw, COVID was a big transformation time for us. We caught up with a lot of the rest of the world in many ways, but we did see the uplift of primary care come to light too. Because we've talked about primary care doctors being the quarterback of your healthcare for many, many years, in different types of models, and we didn't pay them for it though. They were the underpaid physician was a primary care doctor. So we did see an increase in the reimbursements for primary care doctors during COVID, kind of recognize the role that they did play as a quarterback of their healthcare. And I see the same thing happening with pharmacists. I've always felt like the independent community pharmacist is probably one of the most unsung heroes that we have, and underutilized clinicians that we have as well. They're extremely well trained, but they could do more. And then we saw that during COVID, where they were asked to do more. They were asked to give vaccines, get out from behind that counter and set up a little area for patients to receive care. I think that's also going to transform the pharmacy business as we go forward. We just recently had 20 states pass legislation allowing pharmacists to step up and do more from a primary care standpoint for their patients and their clients. And just because of the shortage of primary care doctors, or the care deserts that we have in rural areas, those things are really driving, I think, substantial transformable change that's going to happen for the pharmacists going forward.
Wow. No, that's awesome. I saw that. I was on the front lines during COVID, and all these other businesses, couldn't open because they just couldn't during COVID, and but pharmacies, hey, we had to stay open. We had no choice. And in fact, people working the pharmacies on the front line, you were getting worked overtime. You were just getting beat up. All these sick people coming in, all these prescriptions, phone would ring nonstop. And so, yeah, I think to me, I saw that. I had already sold my pharmacy at that time. But I saw, man, there is such this just opened up my eyes to where there's so much opportunity, so much more that pharmacists can do. And I think that was one opportunity for the public to see, what pharmacists can do.
No, they did. I mean, if you think about it, I mean, you think of years ago, I mean, people would use their pharmacists. Even today, people see their pharmacist on an average of 10.5 times a year. That's more than they see their doctor. So there's an opportunity there for us to really take advantage of that patient relationship that they have. Everybody loves their pharmacist. They do. They're one of the trusted ones, and so we need to figure out a better way. And that's why I'm the CEO of the company that I'm at now at MyPhysician360, is to take advantage of that opportunity and help promote that.
Yeah. So that's okay. Yeah, so tell me about that. Tell me about MyPhysician360. I mean, tell me about it.
Again, I took over the company as a CEO less than a year ago. And before I did, I went out and did some focus groups down in rural Georgia, of all places. 70% of the counties in Georgia, for example, are considered rural by CMS. And I went out and I talked to people and listened to them in these rural parts of Georgia where basically brought in Medicare person, a Medicaid person, a commercial person, uninsured people, young people, old people, and took them to dinner for 2 hours and listened to them and said, hey, how do you access healthcare? Tell me about it. And it made me feel really, really bad. And the fact that these people, what they had, the hoops that they had to jump through to get the basic care that some of us get more in urban areas. But then to hear the stories of not being able to get a prescription or not being able to get to a doctor, and then finding out, that they go for a year with untreated type 2 diabetes because they didn't go back to their doctor and they didn't get the prescription filled. There were just horror stories that made me think there's got to be a better way. And so that's when I took MyPhysician360 and said, you know what, we can increase the access to care for these people by doing things virtually. So we basically took the existing infrastructure of the local community pharmacist and we're overlaying a software on top of it that gives them the option to provide primary care and urgent care services for patients that come into their pharmacy by accessing over 100 primary care doctors that we've got nationally. We operate in all 50 states and really focused in on rural areas, trying to get rid of what we call care deserts and increase access to care. Provides a lower cost of care too for the patient, and saves them time and money. So the patients are actually happier too. They're not driving 50, 60 miles to see a doctor. And we do provide that service to them. And we're excited because we're next couple months we're going to be adding this option for them to use their insurance. And we've contracted with some of the payers, and we'll continue to contract with payers so that the payers look at MyPhysician360 as an opportunity to have a lower cost of care because there's a $0 copay for them. So they want to increase the care because you look at star ratings for Medicare Advantage in the rural areas, there's no 5-star plans in the rural areas, and it's because it's primarily driven because of access to care and not being able to achieve certain quality measures, and making sure they get their A1Cs checked, they're getting the mammographies, doing all the things that really help improve the quality of the patients. So I just looked at it is that we can do better and really looking at the rural areas. And you also see it though in some of the urban areas too. I mean, after COVID, the emergency rooms are still packed everywhere. People go in and it's hard to find an emergency room where you're not going to wait several hours. And so if we can take some of those patients out of the emergency room and provide our service to them in the urban areas, I think that also is something that we can contribute to make a difference with.
Wow, that's awesome. That rocks, man. That so rocks. So are these patients, does the pharmacist actually provide like the A1C check? And I mean, how hands-on is the pharmacist with these services?
They have the opportunity to. Our goal is to provide them the tools, basically the software, so that they can bill, so they can do as much as they want. As you said, their reimbursement for filling prescriptions is nil. I mean, it's really got cut back, and so they've got to I feel that our service, the software that we're going to provide, that we do provide to pharmacists, a couple thousand pharmacies across the country currently. we're providing them the opportunity to step up and do some more clinical work that they haven't done in the past. And as I said, I mentioned those 20 states. I think there's going to be even more states. Like Georgia, I know there's, people are talking to the legislature about how do we increase the ability for these pharmacies to do more for us, because we have a real problem in Georgia because there's just no doctors in the rural areas. There's in 60 counties in Georgia out of the 159, there's not even a pediatrician in 60 counties, which is crazy. And so we have a real difficult time providing access to care. So if we can take technology and use technology and connect these people virtually to a doctor that can provide them some of these basic services that they need, I feel like we can move the needle. And the biggest thing is that we're not increasing the cost. As I said, we're using existing infrastructure. All we're doing is putting software on top of it. And I think that makes a big difference. I'm not out building more buildings and increasing costs. I'm trying to do it very inexpensively. And I think the patients appreciate it too. Patients demand, I think, after COVID, a whole lot more from our healthcare system than they did before, because they know that you don't always have to go into the doctor's office and sit in the doctor's office and wait and do those things. And you can do it from your car, you can do it from your home, you can do it from a pharmacy.
Right. No, absolutely. So, yeah, because I've always thought that, because even before I sold my pharmacy, you had these companies coming out with these tools where you can do strep test, you can do flu test, you could do just this on-site testing. And yeah, I mean, if somebody's strep positive, all right, have a protocol with a physician somewhere and you can treat the patient. But it looks like you're doing that, but you're taking it to another level.
Yeah, and again, we're going to take that opportunity in those states where the pharmacists can do those tests and provide that care. And then the states where they can't do that, then we've got a network of providers, board certified internal medicine physicians that are on call 8 to 8 every day. That as soon as if Mrs. Jones walks into the pharmacy, she walks in, she said, I've got a UTI or I've got COVID. She tells the pharmacist, takes the pharmacist a few minutes to pull it up, and off she goes with her iPhone or her iPad or whatever, has her virtual visit. She's in and out in less than 30 minutes from the pharmacy. And that's really our goal, is to keep it easy, keep it simple. And if they do need testing, we do have the ability to follow up with the doctors and provide those tools to them as well. And a lot of those tools are already, as you just mentioned, already with point of care testing in the pharmacies. And I think we're going to see more of that, or I think we'll see more around radiology and lab. And being more virtual, because it makes too much sense. If you think back to during COVID, there were 29 million virtual visits during COVID. And this last 12 months, there's been 28 million virtual visits still in the U.S. All very segmented, a little bit different, but it's still alive. And people they really demand to have this access to providers through a virtual mechanism like we have at MyPhysician360.
Where can someone find out what states allow this? Because you mentioned Georgia, and there's 20 states.
Yeah, Georgia's not one of them. Again, I think.
They're not.
I know all the pharmacists. No, Georgia's not one of them. There are groups of people that are trying to push legislation in Georgia so that the pharmacies can do that, can provide more services. But like I said, Pennsylvania just passed. Idaho has it. Utah has it. Those are just some off the top of my head. But I know the pharmacists in those states all know that they can do that. But they also don't always take advantage of that. They don't have the billing systems that you've got to have. They don't have the interfaces with the insurance companies. And we're one of the companies that is providing that service to them so that they can do billing, so they can do gap closures for the insurance companies.
Okay. So do you happen to know offhand if Texas allows that, or New Mexico?
I do not think either one of those states offer that.
Okay.
Yeah.
At least not yet. Not yet,
so,
because
and I do believe it's going to change. I mentioned that transformation happening in the pharmacy. just the same way primary care really changed during COVID, I really believe that the independent community pharmacy is going to change. And they have the opportunity to really do a lot more and drive revenues. I mean, that's one thing that I think that we can do for them at MyPhysician360 is we can help drive them additional revenue to their pharmacy as a business owner, but also at the same time provide a great service to their customers, and then increase the quality of care too. So that's, like I said, when I talk about MyPhysician360, I get excited because I see many differences that it's going to help. It's going to help the patient in the fact that they're going to have improved access to care. They have a lower cost of care, lower out-of-pocket expenses. They're going to benefit from having a higher quality of care for themselves. Then the pharmacists, the benefit is really that we're going to increase revenues for them. We're going to increase their patient retention, and probably expand their patient retention when their patient access, because they'll get more patients once the patients know that you can get primary care services or urgent care services at the pharmacy, and especially in the rural areas. I can't tell you, when I sat with those folks in South Georgia, I drove back to Atlanta that night and I just shaking my head. I just felt bad because those people should not have to go through what they go through to get health care. And that's rampant through every state in the union. If you look at it, Florida, I mean, North Florida, Louisiana, Mississippi, Ohio, New York, upstate New York. I mean, there's places where people have to drive a pretty far away to see a doctor. And so every state has what we call, care deserts and medically underserved patients. And that's why I think what we're doing really is making a difference. And we're super excited about our expansion that we're going through right now.
Wow, that's awesome. That is so awesome. So how many pharmacies do you currently have?
2,500 pharmacies have actually utilized our service so far. We're reaching out and partnering with companies like CareRx Partners and others that are out there working with the independent community pharmacies. Obviously, I'm not working with CVS. I'm not working with Walgreens. They're really the competition in many ways. They can't get out of their own way. But the independent community pharmacist is our partner. We're the ones that we want to talk to every one of the independent community pharmacies out there, especially the ones in the rural areas, because I feel like we can make a difference. We can partner with them. We can continue to tweak our software to meet their needs, and make a difference for them, make a difference for their patients. Insurance, like I said, is really just 88% of the population has some kind of insurance. So I think by us being able to contract now with payers, but the only way I'll contract with them is if it has a $0 copay, because I want to take down any barriers to care for the patient, and then also provide it at a lower cost. And that's why I'm saying, no, there's no bricks and mortar. I'm not, we're not a high, margin business by any means, but I'm taking the existing infrastructure and trying to put some things in there to improve it. And that gets me excited about what we're doing after being in healthcare for 25 plus years.
So to me, I'm just listening to you, okay? And if I'm a pharmacy owner and I have an opportunity to expand my services, enhance my business, make it more clinically oriented, okay, as opposed to just, putting pills in a bottle. I mean, to me, that sounds very, very exciting and very, very rewarding, as, you are truly becoming the clinician that we went to school for, that you were trained to be. Right. We were trained to do that.
Like I said, I always felt that the pharmacist is the most underutilized clinician that we have. The nice thing of it is, if you think about the independent community pharmacy and the independent community pharmacist, they've weathered a lot in the last 20 years, the last 10 years, the last 5 years, really weathered a lot. And the thing that they're very entrepreneurial guys and gals that are pharmacists that are in these independent community pharmacies, as opposed to the big chains. And that's why I get excited. That's who my customers, that's who our partners are. These are people that are entrepreneurs that want to make a difference. They're a big part of the fabric of their community. And that's kind of exciting too. And as we get bigger, I want to help invest back into the community and do those things, because healthcare is local. And like I said, I can't tell you enough about that visit I had with those people in South Georgia. It just motivates the heck out of you to get out and say, hey, we need to do something different. And that 78 million people live in rural America. And so if this little group of people is just a sample of what goes on with those 78 million people, we've got huge opportunities to make big improvements. And I think partnering with the local community pharmacists like we are, and listening to them and giving them what they need, and then taking advantage of what's happening on the legislative front that I mentioned, and this is what's gonna transform and make. I think it can move the needle. I mean, there's lots of things that you can complain about. We all hear about it all the time, about what we hate about our healthcare system, we hate about insurance, what we hate about this. But you know what? I think what we're doing and we're focusing in on in our strategy is one that can make a difference and move the needle for a lot of people. We have at MyPhysician360, I mean, we've got a 5-star rating from all of our customers. They love the service. They said, my God, this was so easy to use. And we get pretty excited about that too. And the same thing for the pharmacy. We just got a letter today. I just on the car ride here. One of our agents, she called me and said, I just want to read you this letter. And it was a letter from a pharmacist saying how much they loved Physician360 and that it was making a huge difference in their business and for them to be able to retain customers as well as expand customers. And I was just like, wow, it's really exciting. I should have brought the letter to read it. I mean, it was from it was from a pharmacy in Georgia, that happens to be where I live in Atlanta. Our corporate headquarters is in Atlanta, but we do operate in all 50 states. And like I said, when you look at each state, they all there's a niche, there's a part of the population there that is all really underserved, and I think that we can make a difference. And so talking to your fellow pharmacists, you're an ex-pharmacist, but I believe in you guys. Mm-hmm. Yeah, I believe in you guys. I mean, like I said, at running health plans across the country through the years, I've always felt that they were the most underutilized asset. These are doctors, and they can do so much more, and it gets exciting. And the nice thing too is they're entrepreneurs. All of you guys are, and that's why what we're doing really resonates with them.
Right. Wow. Well, so can you tell me like what the investment is, for these pharmacies? I mean, what does an investment look like? What does the structure look like? What is that?
Yeah, the revenue model that we create for them is, we have a shared arrangement with them on the revenues that we get from the insurance companies. And what we'll do is they pay us a monthly fee for the software that we overlay into but we, look to build them. On average, we're targeting that we can generate an extra $100,000 annually from revenue standpoint if we have the two most major insurers in that market. So that's a lot. I mean, that's a lot of revenue for a small business. And but they pay a monthly fee for the software, and then also we get reimbursed. They get reimbursements for closing gap closures with the insurance companies, and by gap closures that means again the HEDIS measures, making sure that people are having their annual wellness visit, things like that, and gathering that data and sharing it back with the payers. And that's a new version of MyPhysician360 that we're just launching.
Okay. Wow. So how long has Physician360 been around?
The company was founded by an Emory physician that was really focused more on point of care testing, which you referenced earlier, and during COVID, it really made a lot of sense and so on and so forth. But to scale that to a much broader level was kind of a logistics nightmare a little bit, and so what I came in and I took over the company. I said, you know what, I'm going to pivot a little bit. I'm going to let the pharmacists go ahead and buy their tests, and I'm not going to provide those tests to them. They've got resources to go buy those tests and have those, as you mentioned, the point of care testing in the pharmacy. But I'm going to focus in on access to care, having a robust network of physicians that are available 8 to 8 every day, so those pharmacies have someone to talk to help provide that care immediately on demand for those patients. But what I'm also going to do is I'm going to go to the insurers and I'm going to give them, here's an opportunity for them to reduce the cost, because our costs are much less than an urgent care center. And we can do it for a lower cost for them. And like I said, a $0 copay. And so I kind of pivoted the company and really focused in on that 88% of the population that has insurance. We still take people that don't have insurance; they can pay for it, and it's fairly inexpensive, $60 to talk to a doctor and get a prescription or get the service that you need to make you feel better. And that's pretty cheap. People are amazed. I mean, I've had friends that have called me and said, "Oh, I've got COVID." I said, "Well, what are you doing?" I said, "You don't sound very good." He said, "Well, I just moved here. I don't have a doctor." I said, "Well, call Physician360," and they did, and it's just a great service. It's needed. People, again, you need access to care to feel better, and if you're not getting your diabetes treated, you don't get your prescriptions filled, you're not getting these things taken care of, it does lead to bigger challenges from a health perspective, which drives up the cost of your total cost of care. So it just makes too much sense. And so everybody says, "How'd you come up with this?" And I'm just like, it just kind of makes too much sense. It's common sense, and we're super excited. And again, the providers, as I said, our physicians that we've got are board certified physicians and mid-level providers, where they're able to be utilized. And these people are dedicated. I mean, they put on these headsets, and they're on the phone all day talking to patients. And these are people that said, I don't want to go to a doctor's office anymore. I don't want to have to deal with the staff. But these are board certified, really great clinicians, and they coordinate and work with the pharmacists as well, just like they normally would. But the trend, as I said, is for those pharmacists that do want to step out of the box and do more clinical work for them. There's opportunities to do remote patient monitoring and MTM management and things like that we get reimbursed for it and help improve the overall quality of the care the patients are receiving. And so those are things that we also see as opportunities for us in the future to drive more revenue to the pharmacist. That's really what we're trying to do. We want to drive more revenue to the pharmacy, help them transform, increase the access to care for the patients, and increase the quality. And if you stay focused in on those three positive things, I think it's a winning combination.
So you mentioned something, okay, just a little second ago. You mentioned something about M&A. And I know that you've got experience in mergers and acquisitions.
Yes.
That's what I do. I'm an M&A guy. And in fact, I'm the only pharmacist certified mergers and acquisition advisor in the country.
Oh, nice.
Yeah. I'm the only guy. So I'm really proud of that. Really proud of that. So I help, pharmacy owners. I connect them with buyers and sellers. If you're looking to exit your pharmacy, my job is to get your pharmacy sold, for the best price possible. And if you're a buyer, my job is to find the pharmacy for you that provides the most value, okay, for your dollar.
There's a tremendous opportunity with that right now too. Again, there's power in numbers, and I think the one thing that the independent community pharmacy needs to realize is that there is power in numbers. And there's a great company that's just been launched recently by one of the icons in the healthcare business, Dr. Karen Patel. He was a founder of WellCare. He's founded about 10 different billion-dollar-plus companies in his career, and they just launched a company called CareRx Partners and Care Pharm Tech. And what they're doing is providing, again, services so that these independent community pharmacies can band together and look to somewhat to build an exit for themselves. They provide services to them that help them increase the value of their pharmacy. We're one of the tools that is in the toolbox is MyPhysician360 to help them grow their revenue, help them grow their business. And so he's contracted hundreds already pharmacies across the country, and they're looking to help them increase the value of those, increase their ability to negotiate, and just let them know that there's power in numbers for them to really have an exit. And just the same way we've seen with primary care. We saw that with primary care with this big boost of additional revenues to primary care. We've seen big exits, and we saw where CVS has bought Oak Street and others. I think these independent community pharmacies have a tremendous opportunity ahead too as we go through this transformation. And one of the big leaders in that disruption of that and kind of bringing all those independent community pharmacies together is a company called CareRx, based in Tampa, and really making a difference. And they just recently announced that they launched the company last fall. Dr. Kiran Patel, which has a great track record and making differences in healthcare, and super excited about our partnership with them as well. And yeah, I think that's, as you talk about M&A, that's an opportunity too, if they can band together. I think Dr. Patel's goal is to have to be the third largest network of independent community pharmacies behind Walgreens and CVS.
Oh, wow. That's awesome. So tell me about how important is an exit strategy for not just a pharmacy owner, or I mean, just a business owner in general. What can you tell me about that?
Well, again, it's interesting. My local community pharmacy that I have in Florida is a good friend. I've been going there for years. He's 63 years old. He was asking me, he said, "Michael, what are you working on?" And so I told him what we were doing, and he said, and I said, "Mark, what's your exit plan? You've been here for all these years. I've been coming here." And he said, "Oh, I don't want to think about it." And it's unfortunate because many cases of pharmacists, this is their life's work. I mean, like yourself, you monetized your life's work. You sold your pharmacy. I mean, these people need to have, and I think that doing some of the things that we do at MyPhysician360 and then partnering, like I said, with CareRx partners, that's going to give them more platforms to monetize what as I said, their life's work. And because they haven't done that. We saw that happen in primary care left and right. I mean, and it's still going on, where primary care doctors are really kind of building these clinics and really focusing in on value-based care and creating value for their businesses. And many of those primary care doctors, it's their life's work too. And so I see a lot of similarities to what happened in primary care during COVID. Big changes, big consolidations, big groups getting together. I also believe that that's going to happen in the pharmacy space, the independent community pharmacy space, because there's, tens of thousands of them across the country here in the U.S. And with the change in, reduction in regulation that we've had just around virtual care, and then we see this other legislation passing, allowing them to provide care, I think it's a great opportunity to be an independent community pharmacist right now, even though they're under a lot of pressure all the time with these cuts relative to reimbursements by the PBMs and others. And we see that every day. You and I both know that PBMs are not the most well liked by the independent community pharmacies, and it makes it difficult to compete when the big guys own them. But I do think what's happening now, what we're seeing, the trends that we're seeing now with being able to do more clinical work, will give them the opportunity to recoup some of that. And I think we can be a part of that. We can be part of that solution.
Wow. Okay. Awesome. So something that's been going on in the pharmacy space, I'm not sure if you're aware of it, but there's this group that's basically forming a union within pharmacy, because of the working conditions of working at the chains. There's been, lots of concern, for pharmacists, they don't get to take a lunch. They barely get a bathroom break if they get one. And there's been some unfortunate incidents that have happened, at these chain stores. And there's a group out there that's basically forming a pharmacy union. And I had one of their spokespersons on my show a while back. And the question that I have is, do you think, unionization, how do you think that would impact healthcare? Do you think that would, my immediate thought is something like that would drive costs up,
Up.
That's
feel the same way.
That's what I thought, but I wanted to kind of, get your perspective, as a...
It's unfortunate that it gets to that point. I mean, that's the frustrating thing for all of us as a consumer too, and as a provider. And now that we provide services too, healthcare services, it's a shame that it gets to that point. But that goes back to that you've got two big behemoths in the two big chains that drive, and they bought up a bunch of other assets too, and they're trying to convert members, take patients from doctors. And really kind of build their own ecosystem, and I think it's unfortunate because I do think it drives up the cost. I wouldn't driving in a union, that's gonna. I do think like you do that it is going to drive up the cost, but at the same time, these people need to be taken care of. They need to be treated properly too, and it just goes back to maybe they're too big. And I think we see that a lot in insurance as this consolidations continue, and have continued in my lifetime, in my career, that when you continue to get bigger and bigger and bigger, you get inflexible. And then it just it really affects outcomes too, quality. I mean, you can point to a lot of things that happen. Although when they're selling it to the regulators, they're saying, oh, we're going to increase the quality, we're going to drive down the costs. But as you said in the beginning, they're publicly traded companies. They've got shareholders that they've got to answer to. And so that becomes a little bit more difficult for them as they go forward. And now we see, Walgreens and CVS both saying they're closing how many stores and this and that. I mean, but they'll go build more. It's cyclical, like everything, because I think they're more driven by the economics, fiscal economics that they've got to meet for Wall Street, things like that. That's why you look at, again, I'm going to bet on the independent community pharmacy because you know what, they've weathered a lot through last 20 years, and that gets me excited too. That I think we can help them be the underdog, and continue to prevail going forward. You look at Minute Clinic and you look at some of these other things that have gone on within the big chains. Even if you tried to call and get a virtual visit I did that before I even started the company or took over this role, is I sat on hold and waited for 4 hours to get a virtual visit at CVS, and I couldn't do it. They finally I never got my visit. And so it gets exciting, when they're just too big, and it gets exciting for me in the fact that I'll work with all these independents, because these are entrepreneurs that know how to make things happen. And they're really they're focused in on the patient and focused on their clients. And that part goes back to what I said earlier, that people trust their pharmacist. And so that's what makes my job really fun, is people love their pharmacist. They see them 10.5 times a year. And we're going to provide them the tools so that they can provide more services for their patients and make a difference. Again, I just always go back to that group of people that I had dinner with last year, and go back to them and say, hey, we're making a difference for people like you.
Wow, that's awesome, man. That is so awesome. So, well, Michael, so the name of my podcast is the Pharmacy Rockstar podcast, and I only interview rock stars. So, you're a rock star in your own right. What does the term rock star mean to you? Like when you hear the term someone's a rock star, what does that term mean to you?
Again, people that are passionate about what they do, people that want to make a difference. When I think of rock stars, again, we talked a little bit about rock and roll, was about to talk about music, things like that. Those people, they sing their hearts out because they love what they're doing, and I think the same thing that could go for what I do is that I love what I'm doing, and I think I can make a difference. And I think that's really what it means from a rock star standpoint for me, is that I can make a difference for people, for a lot of people and it's exciting. They've got rock stars in every industry, and healthcare is pretty important.
Yeah. Who do you think of when you think of a rock star in business? Like a rock star in business, who do you think of?
Again, I like the Mark Cubans of the world.
Yeah.
People that are trying to make it, I think he's got a great approach in his business ethics and the way he thinks.
Yeah.
I think of him as a rock star.
Mm-hmm.
Who else? I mean, there's got you know, Apple. I mean, all the big names too. I mean, those are people
Steve
that are
Jobs,
making our lives. Steve Jobs made our lives totally changed our lives, and he pissed off a lot of people.
Sure. No, they all do.
Yeah, I mean, I happen to know John Scully, who worked with him at Apple, and you know, but these are great people, and those are rock stars. Those are people that are making a difference, and there's a lot of young people coming up too. That's the other part that gets me excited, because I do advise to a lot of small companies, small startups, and things like that I've done in the past, and the young people. There's a lot of young rock stars coming up, and healthcare needs them. I encourage everybody, my nieces and nephews, their friends, I tell them, please go into healthcare. We need more people in healthcare to make a difference, and rock stars make a difference, and that's what I try and do every day.
Hey, well, before I let you go, Michael, I want to make sure people know how do they get in touch with you? What's the best way for people to get in touch with you to learn more about MyPhysician360?
Again, email is mmuchnicki, MUCHNICKI at myphysician360.com. And I got to tell you, I get a lot of phone calls and a lot of people reaching out all the time. I've gotten random calls saying, I love your model. I just wanted to tell you that I think what you guys are doing is great. And that's motivating as hell for me. And I get those all the time. And it's really exciting, because people do hurt, you know, and especially with healthcare. You know, I loved my job. Even though I was a CEO of a health plan, I would go out of my way to make sure people got the care that they needed. I went against the grain at United all the time, and bucked the system, because I was always very pro-physician and pro-patient, and felt like we need to get out of the middle of that and really promote that. And to this day, I have many provider friends, CEOs of hospitals, CEO of medical groups that still know me, because I was able to knock things down for them. And I feel like I'm still doing that. And that's exciting.
Oh, that's great. That's so great. That's great. Well, look, one thing that I saw in your bio is that you served on many boards. I mean, you served on a lot of boards, but the one board that really got my attention was the Rock and Roll Hall of Fame. Tell me about that. I cannot let you leave without talking about that.
That was, again, I was a young CEO in Cleveland, Ohio, when I was a CEO for United. And I grew up in Cleveland, and the Rock and Roll Hall of Fame is in Cleveland, and did a lot of community service. And one of the CEO of KeyBank at that time was the chairman of the board at the Rock Hall. And he said, Michael, he said, we would love to have you on the board. He said, and I was ecstatic, because I grew up in Cleveland, home of rock and roll, as everybody knows. And so I was on the board there for 10 years. And I have a big jacket at my house that's been mounted in a box that has my name on it, the Rock and Roll Hall of Fame. But during those 10 years, I mean, I had some incredible journeys and experiences that I am so fortunate to have. And I tell people, the one was to sit with Aretha Franklin up in at the Cipriani up in New York, and have her sit and play Christmas music for about 10 of us for 2 hours. See the Eagles in Dublin play. I mean, just some really, seeing Madonna get inducted at the Waldorf in New York. Just some really great experiences that I was able to enjoy. And it's nice because my roots are from Cleveland, and my family still lives there. And I always have a special place there for the Rock and Roll Hall of Fame. And I encourage everybody to go, because it's a great, there's so much history, and music makes you happy. Music makes you happy. So, but yeah, thanks for bringing that up. It was a great experience, and my way of giving back too. That's why I do a lot of those nonprofit boards. And as I said, as MyPhysician360 gets bigger, and we work with these local community pharmacies, it's really important because they're a part of the community's fabric in every small town, and I want to be able to help them do that and continue to be a staple in those communities.
Wow, now that's awesome. That's great stuff. But I got to ask you the toughest question of all.
Okay.
This one, I'm going to get you now. Who is your favorite rock star? Who is your favorite musical rock star?
God, I know. That's hard.
I know. That's why I
that.
saved it for last for you.
I love myself some Stairway to Heaven with Led Zeppelin.
Yeah. All right.
Yeah. So that's hardcore rock and roll. But
Yeah.
I do love that. And if you think back, I think it was probably 3 or 4 years ago at the Kennedy Center Awards, and Heart actually played Stairway to Heaven.
Wow.
And the guys from they were sitting there listening to them. So it was pretty moving.
That's awesome. That's awesome. You know, are you a fan of Quiet Riot?
Yes. Oh yeah.
Quiet Riot, AC/DC. Okay. No.
AC/DC, AC/DC, of course.
Yeah. Well, you know, Rudy Sarzo.
There's so many good ones.
Yeah, well, Rudy Sarzo, you know, from Quiet Riot, he played with Randy Rhoads on Quiet Riot, and then whenever Randy went to join Ozzy, Randy talked Rudy into going with Ozzy, and so Rudy went with Ozzy, and then Rudy went on to Whitesnake. Well, I had Rudy on my podcast a few months ago.
Did you really? Wow.
Yeah. So just subscribe to our channel at BuySellRx on YouTube, and you'll be able to see that interview that I did with Rudy Sarzo.
Oh my God, that's fantastic.
Yeah.
There's so many, so many great people. And, you know, every year they have the Rock and Roll Hall of Fame inductions. I get so excited to see who's going in. And it's, like I said, it's great for Cleveland too, being growing up there. But no, music's important, and it's a part of healthcare healing too in my mind.
No, it is. No, I totally agree.
It helps you heal.
It does.
Helps you heal.
It really does. I truly believe that.
That's super exciting. Yeah.
Awesome. Well, Michael, thank you once again for joining me on the Pharmacy Rockstar podcast. It has been such a pleasure to have you. Thank you so much.
Well, thank you for the opportunity too, because like I said, we want to make a difference, and I'm out there trying to make a difference every day. And I think we're doing it with MyPhysician360 and working with those local community pharmacies every day to see how we can improve their services for their patients and make a difference. And I really believe we are making a difference.
No, you are. So look, if there's anything that I can do for you, please let me know.
Appreciate it. Thank you so much for today.